To Anwar and the Knox project for taking the initiative and working within the council and in particular with the partners, Queen Mary University, other partners who are here, the police, the TOs, Usmani project. We can't do this as a council on our own. It has to be a partnership-driven project. It's about working with, helping, supporting our youngsters. It's not about criminalizing them. It's about treating them, deterring them from the evil of this nitrous oxide. As we know, it's a laughing gas, but it's serious. The consequences, as the professor said, is potentially serious. The fact that they will go into all the schools, they will go into the community organizations, the youth organizations, and to spread the message, the health risk, the dangers and the consequences of taking laughing gas will be a strong deterrence. We need workshops in our communities, reach out to the very people who could be exposed to the dangers of this kind of substance. That's very important to us. But also the fact that there is a deterrence. If someone gets caught with this material, they will have a choice to go on the program, the workshop, and not be fined. Fine will be as a last resort. There will be a diversionary program involved. That is very important. But also, the timeless enforcement officers, the police officers will get the training to work with someone who is exposed to this, to support them, work with them, to deter them. That's very important to us. So I'm fully behind this project. We very much want to see that our youngsters do not become criminalized, but this is becoming law later on in the year. It will be classified as a Class C drug. And the consequences for anyone found or misusing that will be quite serious. So we want to deter people. We want to treat those who have a problem and help them to come out of it. That's very important to us. Sure. Our training standards are very good. Timeless enforcement officers, TOs are very good. Police service in Timeless I very applaud them for the work they do. So there will be much more, already there are much more monitoring. And if there are any shops or anyone selling any substance, illegal substance, believe me, the full weight of the law will be enforced on them, will weigh down on them. And with the Act coming into power end of the year, that will give us and the authorities much more power in terms of enforcement. That's for the enforcement. So I will say to the corner shops, please be careful. And be careful in what you sell and to whom you sell. You should not be selling anything of unlawful nature to anyone. That's very important. But also that we are redesigning our enforcement services. If there is a particular issue during the night, late at night, we're going to pick that up. We're picking up a lot of things now in any event, but with the new redesign of our enforcement services, we will pick up any additional problems that may arise. Can I also say, parents are extremely important in this. You know, I've always said, you do a fantastic job in educating your children, bringing up your children. Please keep a close eye on them at that very critical age when they're teenagers. Work with them, speak to them, discourage them from engaging with anything that is unlawful. They should play hard, obviously, but they should also concentrate on education. That is the time to take advantage of the opportunities that education provides, improve their life chances, get a good education, and get a good job afterwards. That should be their prime objective in life.
What we've seen over the last few years is an increasing number of mainly young people coming to hospital with harm due to nitrous oxide. And this includes tingling and numbness in the arms and legs, difficulty walking. Some people can't walk at all when they come to hospital, problems with the bladder and bowels and sexual dysfunction and things like that. And this is a rising problem, particularly in Tower Hamlets, but also in other inner city areas across the UK. We are very mindful that young people using this who develop symptoms must stop using nitrous oxide as soon as possible and come to hospital to get treatment. It's very important.
So good afternoon, I'm Joe Singh, Superintendent for Neighbourhoods in Tower Hamlets and St Rees BCU. Firstly, I welcome the Know the Risks project. I think it's a welcomed diversionary and educational piece, which I think will go a long way in raising awareness around the risks around nitrous oxide. This is an issue we can't deal with by enforcement alone. So I think this morning we saw the project being delivered to young students, which I think was really impactful. And I think the second part of the day is about the same content being delivered to officers and THEOs as well, to give them the knowledge to share that further when they're encountering people out on the streets. So I welcome it, yeah.